Good morning, all of you. My name is Chandravin Nandu. I am from Jalna. I recently passed out my Bachelor of Pharmacy in Dr. Babasaheb Ambedkar Technological University. Today's subject is technical, and today's topic is minimum criteria for reporting. So we are start. First of all, pharmacovigilance reporting refer to the collection, assessment, and the monitoring of the adverse drug reaction and other drug-related safety issue. Ensure the patient safety to improve understanding drug risk benefit for profile. Regulatory authorities such as the FDA, EMA, WHO established the guidelines for the pharmacovigilance reporting. These guidelines other minimum criteria for submitting related adverse drug event, ensuring the information provided through the clear and facilitates effective analysis, decision making, etc. Then minimum criteria for pharmacovigilance reporting. The report adverse event of pharmacovigilance is information criteria, key data, element required such required. These elements are clinical for regulatory authorities, healthcare professional, and pharmaceutical companies, and monitoring access safety drug to the market and below to the minimum criteria must be included pharmacovigilance reporting outside by the international standard in the ICH E2EF guidelines. The pharmacovigilance guidelines, WHO Global Individual Case Safety Reporting means ICSR, and FDA EMA guidelines as a document. Patient information demographics, age, first of all the age, the patient age, the crucial understanding risk factor and adverse event, example pediatric, elderly. Then gender, the male female ADR different based on the sex. Then next one is weight and height. The some cases of weight and height is relevant to, especially in the case of dosing error and drug interaction. Then drug information is suspect drug. The name of suspect drug is include active substance, brand name, and strength. Then route of administration, how the drug is administration, for example oral, topical, and intravenous, intramuscular, etc. Then dose exact dosage, amount, frequency, including the duration of treatment. Then the start and stop date, the when the drug was started and when it was discontinued. Then batch number, then concomitant medication. Concomitant medications mean any medication the patient taking that cloud interact with the suspected drug and contribute to the adverse event. Then adverse event detail, the description of adverse event, a detailed specific description of adverse event is description should be included. Nature of the adverse event, for example rashes, headache, and nausea. Then onset time is when the symptoms for appeared in the relation of starting of the drug. Then severity of the reaction, outcome of the reaction, etc. Date of onset, the exact date of approximate period with the adverse event first appeared. Then outcome, the final status of the adverse event, recovery, treatment, disability, ongoing. Serious criteria, the indication of the adverse drug reaction is serious, that is leading to the hospitalization, permanent disability, life threatening condition at the date, the medical significant, etc. Then serious adverse event and require to the immediate reporting. The casualty casualty assessment is the evaluation likelihood the drug caused by the adverse event. Different method by can be used, including World Health Organization narrow algorithm, suspect drug. Then temporal relationship, dechallenging and rechallenging information. In dechallenging and rechallenging information, the applicable details whether the adverse drug is resolved and was discontinued, dechallenge, and whether the event recurrent reintroduction of the drug is rechallenged. Action taken, drug withdrawal, then drug modification, then treatment of adverse event, etc. Medical history, the relevant medical history, any pre-existing condition contributing could influence occurs of the outcome adverse event. Liver disease, renal disease, and allergies. No allergies, any previous allergies reaction of the substance. Reporting information, reporter identify name of the contact detail and role. That this information help follow the more of detail needed. Reporter country, the reporter country is the report made of the pharmacovigilance, and requirement may be from one region to another region. Then follow up is applicable. The updated information. The initials was the complete new information becomes available. Follow-up reports should be submitted. Update case. Then death or serious injury. The is applicable. Then additional consideration, drug interaction, pregnancy, lactation, special population, etc. Then regulatory requirement for reporting, timeline, case reporting, global reports, etc. Conclusion. The minimum criteria for pharmacology reporting, the adverse drug reaction, accurate, complete, timely, by included detailed patient drug and information description, the adverse event casualty assessment, follow-up details. This reports is healthcare professional, regulatory authorities, and pharmaceutical company to detect the evaluate, mitigate, and the risk associated with the proper pharmacovigilance reporting, essential for the patient safety, drug efficacy, and overall public health. So thank you for watching my video.